So this healthcare tax credit is pro-jobs, it's pro-business, and it starts this year. This month we're going to be sending out details on how to apply for this credit to millions of small businesses across the country. But if you want to learn about it today, we're going to put all the facts on our website, www.whitehouse.gov. All right, so that happens this year. Here's what else happens this year. Tens of thousands of uninsured Americans with pre-existing conditions and parents whose children have a pre-existing condition will finally be able to purchase the coverage that they need. A man named David Gallagher, whose daughter Lauren had written me a letter last year. When Lauren's mom lost her job, their entire family lost their health insurance. When they tried to get new insurance, David was denied coverage because he once had a complication-free hernia surgery, but the insurance companies wanted to weed him out. They figured, well, the guy's been sick before, we don't want to have to cover him, we don't want to bear that risk. So Lauren's been worried sick about what would happen if her father became ill or injured. Now, because of this reform, David Gallagher can finally have access to health insurance again. That begins this year. That's just one of the insurance reforms that starts this year. Here's what else happens. Insurance companies won't be able to drop people's coverage when they get sick, or place lifetime limits, or restriction annually. This isn't some abstract concept. There was a story in a local paper this week about a woman named Teresa D'Andrea, and Teresa's husband, DeAndre. Excuse me, thank you. Where is she? Are you up there? Stand up. Now, Teresa's husband passed away recently from cancer. And before he died, he hit the lifetime cap on his insurance. And as a result, Teresa's not only had to cope with the loss of her husband, but with $60,000 in medical bills. And this after she's already spent all of her retirement savings on medical care. Now, because of this reform, a situation like Teresa's won't happen again in the United States of America. And that's going to start this year. This year, all new insurance plans will be required to offer free preventive care. And starting this year, this may interest some of you, if you are a young person who doesn't have insurance or doesn't have a job that offers insurance, you're going to be able to stay on your parents' insurance policy until you're 26 years old. Now, you're welcome. Thanks, Shelley and Mike. They voted. This year, seniors who fall into the coverage gap known as the donut hole. Some seniors probably know about that. They're going to receive $250 to help pay for prescriptions. And that's just the first step, because what we're going to be doing is, over the next several years, closing that gap completely. And I want seniors to know, despite some of the stuff that's been said out there, these reforms don't cut into your guaranteed benefits. What they do is eliminate co-payments and deductibles for preventive care, like checkups and mammograms. You will be getting those for free now. This is why AARP supported this bill, because it's good for seniors. It's the right thing to do. It's good for young people. It's good for people who hit these lifetime limits. It's good for people with pre-existing conditions. All that happens this year. And then, by 2014, each state will set up what we're calling a health insurance exchange, but it's basically just a competitive marketplace where uninsured people and small businesses who right now are out there on their own trying to negotiate with insurance companies, they can now be part of a big pool. Millions of people come together, leveraging their purchasing power, which is going to lower their rates. They'll get a better deal. You know, Walmart, the reason they are able to give you low prices is because they buy and they tell their suppliers, yeah, we're the biggest, we're an 800-pound gorilla when it comes to whatever product you're talking about, so you've got to get better prices. Well, the same thing is true when it comes to the insurance market. So everybody who can be part of this pool is going to get a better deal than they would otherwise get. And by the way, members of Congress are going to be part of this pool. So you know it's going to be good, because they're going to have to use it themselves for their own family. And when this exchange is up and running, millions of people are also going to get tax breaks to help them afford coverage. So even though this pool will give you lower rates, you'll get a better deal, some folks still can't afford it. So we're going to give you tax credits to help you afford it. And that adds up to the largest middle-class tax cut in health care in history. That's what this is about. We're setting up a pool using the private market to give people a better deal. We're giving tax breaks to working people. Some of them working 2-3 jobs who still can't get insurance. We're going to give them some help. We're going to give small businesses help so that they can help their workers and improve their bottom line. And we've got a whole bunch of insurance reforms so people like Teresa aren't going to be disadvantaged and taken advantage of when they need it most. That's what this bill is, and it's paid for, and it saves on our deficit. Now, this is what everybody's been hollering about as the end of freedom.
I can see that. Good point.
And now that it's passed, they're already promising we're going to repeal it. They're going to run on a platform of repeal in November. And my attitude is, go for it. I want these members of Congress to come to come out of Washington, come here to Maine, and tell Mr. Milliken there, you know what, we're going to take away your tax credits, essentially raise your taxes. If they want to do that, be my guest. If they want to look at Laura Gallagher in the eye and tell her they plan to take away her father's ability to get health insurance, that's their right. They want to go tell Teresa that once again you could face a lifetime of debt if you lose a family member. They can run on that platform. If they want to have a fight, I welcome that fight, because I don't believe the American people are going to put the insurance industry back in the driver's seat.